Good morning, everybody, and thank you so much for joining us on this Monday morning. It is Medical Monday, and one of the things that we might discuss today could be something that you're dealing with, and so hopefully we can find some health answers for you. But we're going to start off with Hot Topics. And on our medical panel today for Hot Topics, we have Dr. Shalina Laji, Wellness and Aesthetics Medicine Specialist.
Good morning.
We also have Dr. Syed Raza, Interventional Radiologist, and Dr. Stephen KHOU, Hormone Specialist. Good morning. And what you're seeing right there, since this is the first day of school, what are we seeing? What did we just see right there? Can we get that picture back up again? There. Who is that, Dr. Shaw?
No
Who is that? Okay, that is you. And
Yes.
of course, know that you were a good student. All right, Dr. Raza. Do we have Dr. Raza's school picture here? Let's take a look. Oh, look at that. Yes, look at you right there.
Still look the same.
Yeah, haven't aged a bit there.
Exactly.
And Dr. Stephen KHOU, where's Dr. KHOU's picture? And there it is. Right. Look at you. Okay. And my picture is on the way from somewhere. Somehow we lost that picture. That chubby little girl picture with the strange little hairstyle there. All right. This is the first day of school for many parents, most of us. You know, it's the day that the state basically goes back to school. HISD being the 7th largest school district in the country. So if you haven't noticed, traffic is a little heavier this morning.
Bit, yes.
A lot of times we love the summer because our kids are off and doing their little things. But when school starts, we feel the pressure to be the super parent.
Right.
And studies actually show that we have this depression, anxiety, all those things can happen when you have that kind of stress.
Absolutely. And I think, you know, being parents, all of us being parents, it really is obvious that all of us go through a lot of things where we feel like we need to be involved in their school and be a good professional and not just be involved.
You're like being involved in school. I'm like, just get them to school on time.
Right.
Before the bell rings.
Right. But there's so much that parents are doing these days that you feel compelled to kind of keep up. And I tell my patients, it's really important to be a happy and a healthy parent rather than be a super parent and try to feel like you're just the best at everything.
Yeah, you all
can't
obviously
be.
were great students, but did you get that pressure from your parents, or is that something they just instilled in you, and so it wasn't pressure, but something you wanted to do?
It was, I think it was instilled just the family values we had, and they never were tough on us, and so I just enjoyed school.
Yeah, yeah. But with that said, we talk about stress, and we hear that word stress all the time. I think we oftentimes just kind of throw it all away and think that it's not really it's not a disease in itself, but we forget what stress really does lead to. And it does lead to a lot of other issues.
Absolutely. Most chronic diseases are actually caused by stress. Stress is the #1 killer in this country because it creates and really, you know, amplifies a lot of different diseases.
Right, right. Okay. In Hot Topics, there's this thing that came out that says Botox is used as a new treatment for stomach cancer. We've seen Botox used for all types of things. You know, obviously the wrinkles thing is probably the biggest thing a lot of people look at. Aesthetics. Yeah, we always go for aesthetics first, right? And then we've seen it used for like migraine headaches and some other things. But interesting here, it says Botox slows the tumor growth and blocks the nerve signals that stimulate cancer stem cells. So very interesting here.
Very, very interesting.
I think the cancer cells are predominantly supplied by a lot of nerves. So acetylcholine is a big transmitter which is released by these nerves. And that is the substance which is inhibited by using Botox. And that's how the scientists worked out that if we block the release of acetylcholine, we can actually inhibit the growth of cancer cells.
Yeah.
And that's what this topic is all about, that, you know, the Botox can be used for your beauty things and can also be used to treat cancer.
Yeah, so just go in and just Botox, more Botox right there. Okay. This next one is talking about stents. We certainly know that stents are used in, you know, dealing with the heart, but they say that stents to treat vein obstructions can also be used. Stents have long been used to treat the narrow or blocked arteries, and so now research is underway in veins, which is really good because veins is one of those areas too where a lot of people have ignored it because in the old days we would do the vein stripping and they didn't want to do that. Technology has changed, and this is part of that technology changing.
I think this is great news for people who have chronic DVT, where they had blood clots in their veins and their legs became swollen. It's called post-traumatic syndrome, where you get a clot in your veins and then the leg is swollen. It's very painful. It's very hard to deal with. We see about 2 million cases of DVT in the U.S. every year.
Yeah.
So this is great news for those patients who have these chronic issues with their veins and with their pain. Once you stent these veins, the blood starts flowing back up to the heart again, and that relieves a lot of pain and a lot of discomfort in these patients. I'll tell you a little story about one of our patients that actually I did do this procedure. She had DVT like 30 years ago. And once I fixed her veins and opened it with a stent, the follow-up visit when she came after 2 weeks, she was literally in tears, and she gave me a big hug. She said, "You have really changed my life."
Yeah, because it really does. People
is.
suffer
Yes.
through stuff, and then they realize, that there is an answer out there. Speaking of, people suffer through the hormone thing. For so many years, we've been told it's just a part of aging. You're just going to have to suffer through it. But today, we know that there are lots of benefits to just replacing what it is that you've lost naturally. The key is doing it naturally. But there was a study out talking about hormones in early menopause and how that could possibly protect or not against heart disease.
Well, this was a study that was just published in the Annals of Medicine, and it's a reevaluation of the KEEP study, which was done 2 years before. It's a 4-year study of women, which really doesn't give you a long enough trial to know how hormones really work in the long term. The study basically said it didn't seem to decrease the risk of heart disease if you gave these hormones, but they didn't give natural bioidentical hormones. They gave Premarin. And they gave they say in the article they gave progestins, and I'm sure that's correct. There was another article published in the British Medical Journal 2 years before called the Danish study, and it studied women starting at the age 50 for 10 to 16 years using bioidentical estradiol. And it showed in those women that they had a decreased risk in heart disease and a decreased risk of cancer. Of strokes and of blood clots.
Yeah.
So, and these were Danish women, half of whom smoked. So it showed a significant positive impact of bioidentical hormones.
Right. And the key is, I think, with hormones, too, is I think sometimes people get things mixed up, is that you should be taking the bioidentical hormones if you show that you're deficient in them. You don't just take them just because. Anything you take just because can be an issue.
Well, it is always important when they publish these studies to understand who's trying to prove what. And they don't tell you what they're using. They were using Premarin. Well, Premarin is not a natural bioidentical hormone for women.
Yeah.
So it's the Wyeth Pfizer group that's trying to get women to feel comfortable about taking Premarin again, and they gave very low doses. They didn't have the side effects they had in the Women's Health Initiative about 14 years ago that showed it was significant when you use Premarin in high doses with the progestins. It caused significant increase of breast cancer and heart disease and a host of other problems.
Yeah, because the bottom line is
when it's apples and oranges is what I'm saying.
Right. Because if you say bioidentical, and NASA's done work on this with the bioidentical insulin, all that type of stuff, your body has no idea it's not making its own stuff. It recognizes it. Well, when you have the synthetic things, that's where we kind of get into trouble because your body's going, I know I kind of need something here, but what exactly are we doing? And so that's where you draw the line between bioidentical and synthetic.
Right.
But sometimes people might need that synthetic.
And let's say, well, the Premarin is a bioidentical for horses.
Okay. Right. So it goes beyond the synthetic versus bioidentical. It's what does the human body recognize as its own? All right. And then lastly, there's a study that says having good neighbors is good for your health. I agree with that. So people with strong ties to their community had healthier hearts.
There are studies that, women especially, if you have a close-knit of girlfriends, and if your hormones are balanced, and if you're nutritionally balanced, and if we're doing all of those things, get it together. But having good neighbors, having good network of girlfriends, and even for men, having a good network of friends, that really gives you emotional health. Yeah. It gives you spiritual health. And then, of course, you need to work on your physical and your mental health, which is why we're all here today.
All right, with good neighbors. Okay.
There you go.
If you have a question for any of our doctors today, you can email us at greatdayhouston@khou.com. Hey, since